The MENA Talks, a podcast series by the BIC on the Middle East and North Africa. Once a month, our hosts, along with special guests, will explore underlying historical, economic, social and political drivers behind today's systemic issues in the MENA region. The BIC is present on Facebook, YouTube and Twitter. Follow us and subscribe to receive our latest news and publications.
Welcome everyone to this episode of the MENA Talks podcast. My name is Ben Lowings. I'm a political analyst at the Brussels International Centre, and today I'm lucky to be joined by Dr. Asil Sidahmed, who is a former strategic advisor to Sudan's Minister of Health. Now, in October of last year, on the 25th, Sudanese military forces under General Abdel Fattah al-Burhan took control of the transitional government in what was now known as a coup d'etat. Civilian Prime Minister Abdallah Hamdok refused to declare support at the time and was placed under house arrest along with other governmental figures. As a result of this, there were mass internet shortages, social media blackouts, and a number of other measures taken against the population who rose up in mass protests against the military forces. Since then, there's been much repression, over 70 casualties reportedly, but these figures are disputed. Well, eventually on the 21st of November, Mr. Hamdok signed a deal that reinstated him as Prime Minister. However, this deal was rejected by many key actors in the civilian protest movement, including the Forces for Freedom and Change and the Sudanese Professionals Association. Hamdok eventually resigned again on the 3rd of January of this year in the face of the continuing protests. More recently, the United Nations has offered to act as a mediator between military and civilian leaders, though the future remains incredibly unclear. So, to begin our discussion, Doctor, what from your experience happened in October on the ground in Sudan? What was it like working in the transitional government when all of these things were happening?
Thank you, Ben, for the warm introduction and for having me on the show. I would say that, very early morning, Monday, the 25th of October, I actually had received a call from my brother in America who had gotten wind of the news before we did. So I woke up and found the rest of my family observing the television that essentially individuals allied to the military had arrested and detained a number of senior profile ministers and leaders of political parties, and had announced that the government would be removed. Now, this didn't happen out of a vacuum. Obviously, there were preparations and warning signs for at least, a month, 2 months beforehand. And prominent analysts were also already predicting that such a military coup would happen. For example, Khulud Khair, who's been writing quite prolifically about the military dynamics, the transitional process, and doing really excellent political analysis. She predicted the military coup from around last summer. Partly because there were cracks in the transitional government, and partly because of the terms under which the military partnership was taking place, as well as the kind of service delivery and basic economic situation in the country last year. Now, one of the major tools that the military that the junta used around, let's say, September 2021 was to launch protests in a fashion very similar to former Yemeni leader who was also ousted by the Arab Spring, Ali Abdullah Saleh. When Ali Abdullah Saleh in Sana'a was given, had protesters coming, to start rallying against him as the president of the country. He saw what was happening in Libya and Cairo and immediately organized a group of protesters in favor of him staying in power in Tahrir Square, in Freedom Square. So he turned it all on its head. And now you see a similar tactic that was used by Burhan, and let's say maybe more of the strategists and advisors that are around Burhan, which we might want to get into a bit later, because I think that's an area that we can certainly start speculating about and drawing things together, but it's not very concrete who's doing the groundwork on behalf of Burhan, other than, of course, Hemeti. Now, Hemeti, as you very well know, He's quite a charismatic character. He's quite young. He is known as sort of the leader of what have been termed the Janjaweed. The Janjaweed is a term that some of your listeners might have heard of in relation to the conflict in Darfur. But essentially it could be best described as a paramilitary group. And Hemeti, as leader of the Rapid Security Forces, has sort of created from a very small kind of tribalized armed group that got a lot of its money through smuggling gold in from Chad and through various means within the black market in Sudan. He was very much the right-hand man for the former president, for Umar al-Bashir. And the thing is, all the military, including the security apparatus and the rapid security forces, had some level of immunity after the 2019 agreement, after the revolution, partly because they sold Umar al-Bashir out. So there are speculations and talks that, Hemeti didn't see himself rising any further with Umar al-Bashir, so he sold him out. But there are a lot of documents that may have been destroyed by now that demonstrate the role that the Rapid Security Forces played in gross human rights and international humanitarian law violations in 2019. The documentation for those violations at the moment is something that I see a number of people on the ground beginning to formalize and to work on. But one of the main strategies and tactics of the military junta from October 25th was the old school tactics that the former regime has always used, which include shutting down of all social media and telecommunications, as you pointed out. Now, in more detail, what actually happened is every single telecommunication channel, which is basically Zain, the Kuwaiti company, Sudani, which is the kind of national company, and MTN, which is a sort of regional favorite. These companies, were not, which are also responsible for much of the Wi-Fi in the country. They were all shut down almost instantly. Our Wi-Fi, Kanar Wi-Fi, took a couple of days to be shut down, but basically for a few weeks, nobody had access to any internet, even those with Wi-Fi, unless you had satellite Wi-Fi services. And that meant, shutting down essentially of all types of services in the country. I mean, banks didn't have money. You couldn't actually get money out of the banks. The first day, Monday, the 25th, just going to the shops, you saw it was almost similar to the first days of COVID in Europe and the UK, when you'd go to a shop and there'd be like no toilet paper. It was the same those few weeks in Khartoum. There was very difficult to find water, very basic food items. And the really significant thing is that a lot of the way that life is lived in Khartoum is based on short-term usable in-house resources. There's not a lot of nationally equipped things like a grid, which are some of the objectives of the transitional government. So it means that if you're at home, you don't have central heating or gas, you have a gas cylinder. And when that gas cylinder, runs out, you have to find a way to get one. And there was already a huge gas and petrol shortage in the country. However, the thing that was interesting is that at least in the early days, that the currency was resilient. One of the major things that the transitional government had managed to achieve was lifting Sudan from sanctions and also getting the economy, at least at the macro level, back on track. And I think next year, my view from having worked within the government, I thought that the policies and plans and the budgeting that we've done, which included quite large sums of money from the World Bank and from the IMF. Many of these were very low interest, high return loans from the World Bank. And we also had several grants, especially at the Ministry of Health. We were the first recipient of a World Bank grant for accelerating access to COVID-19 vaccination. So actually Sudan, during the period of the transitional government, was able to be the second African country after Ghana and the first Middle Eastern country to apply for the COVID-19 vaccines mechanism, as well as the AVAT, the African platform for access to vaccine technology. all of these things require a civil service that's functioning. So one of the main tools that was used for resistance, other than the streets and protests, was civil disobedience. The days following the coup, it was announced that, okay, none of the ministers are supposed to be going to work, but it was unclear who would be left within the civil service. So every other day you would hear of somebody different getting fired. But it wasn't always clear what the strategy was. There were quite a number of senior civil service officials who, in Burhan's speech, were not supposed to be removed. It was only the undersecretaries and the ministers of health. But in the early days of the coup, we certainly saw a number of old guard, NCP, the National Congress Party, which was the former regime affiliated individuals, returning to senior positions within national institutions such as the Bank of Sudan, the Ministry of Health, the Ministry of Justice. Profiles such as myself, diaspora, who had come in for a short period of time specifically for the transitional period. Interestingly, many of us were also asked by the military to stay on, demonstrating, I think, that they really understood that finally that they wouldn't have the international backing that they needed to be able to continue their work. One of the main strategies and tactics of the civil service was civil disobedience, in particular in the beginning few weeks. It was a time, I think, when everybody was sort of suspicious of each other. There was a lot of mistrust. If you had a day or a moment when the phones would come back, or you would find access to internet through a satellite channel, then, it would be very careful who you would speak to, what you would share with them, because it was becoming clearer and clearer to people which side people were on. So it became very much a polarized moment in Sudan. Before the coup, I would say it was sort of everybody struggling with the transition. And after the coup, it basically became two camps, either for transition or for military. And there wasn't really any camp that was in the middle. This meant that there were civil servants able to still run operations for the ministries, for the state, but at an extremely low capacity. So in the health system, we saw, for example, a total absence in October, November, and much of December of reporting on routine disease outbreaks that kill far more people than COVID-19 does annually. The largest disease burdens include, malaria, which I think in 2018, you had almost 5 million reported cases a year of malaria. Now it's very difficult to do a number of things, which include, for example, getting much needed supply into the country. For example, for malaria, there is distribution of bed nets as one of the primary preventative measures. And the Ministry of Health is funded by one of the key funders is the Global Fund, who provides a significant annual donation to which has to be reported against for malaria tablets and mosquito nets. Now, without a specific supply system or anybody who's in one group in power, it makes supply into the country very difficult. It meant that Port Sudan was blocked off, especially because for a period of time, the governor of East Sudan, of Port Sudan in particular, his rhetoric was very much in favor of the military. And this, I think, gets back to kind of one of the discussions that you and I have had before about who are all these different stakeholders. Because while I've characterized it as very much a for and against military rule, all of these camps and factions can be divided and subdivided, I think, into very much competing priorities that can shift, competing interests that can shift over the course of a few weeks. One key group whose reaction to kind of assess to this that's really significant are the heads of the 18 states of Sudan's sort of federal system. Now, the federal system has always been something that's quite complicated and challenging in Sudan, with criticisms that a lot of resources are centralized and concentrated in Khartoum. This was a major kind of criticism levied against the former regime, and also criticism around the kind of racism that was prevalent amongst the former regime. There was a big fear amongst people in the periphery, particularly in places like Darfur, South Kordofan, and the east, that there wasn't enough representation from the periphery in the transitional government, meaning people who are more from the Nilotic tribes, a lot of diaspora, and a lot of people from very specific class backgrounds. And the Juba Peace Agreement, as much as it is lauded as a failure, and I think there's many good reasons, while I'm not a specialist on peace agreements, I would say that, it didn't necessarily bring us the dividends in health that we were hoping for. But generally, I think the Juba Peace Agreement in late 2020 created an expectation of the second transitional government, the second cabinet in February of last year, which was supposed to be, as many of the parties represented as possible, a widening of a group known as the Forces of Freedom of Change, and getting us one step closer towards elections. So rather than having the sort of technocratic government that had been leading the country straight after the revolution in 2019 to 2020, the Juba Peace Agreement, hosted in Juba in South Sudan, had basically the who's who of every armed civilian group in the country. And that included, former Minister of Finance, Jibril, who is a prominent figure and leader in a movement called the Justice and Equality Movement, a major political party from Darfur in Sudan, that was painted and presented as pro-military exclusively, when actually there were quite a number of tensions within the Justice and Equality Movement. The Justice and Equality Movement had some Islamist roots in the 90s, but split off from the former regime. And now I see the Justice and Equality Movement really having a struggle between, a desire for a just, fair, and inclusive transitional governance process at the center that really incorporates and includes the periphery, and then sort of this dependency and reliance on some armed groups and factions that have formed some of the financial backing and the popular base of figures like Jibril. This actually led to the deputy of the Justice and Equality Movement, who I believe is based somewhere in Europe, potentially in Holland, to resign because the former deputy of JEM was not in favor of the military coup. Everybody, I think, was agreed amongst all these factions that the status quo wasn't working. The transitional government 2.0, with over 20 ministers, as well as new heads of these 18 states, in a kind of regionalized attempt to get peace back on track. These were not, these were very strange bedfellows between February 2021 and October. So there are some that would, have quite a strong case to make if they were to argue that the Juba Peace Agreement was actually, the planning party of the downfall of the transitional government and the roadmap to the military coup. My sense from working within government and speaking more on the civil service and practical side to factions from various different political parties, I would say that each party, each group, each faction, after 30 years of single party authoritarian dictatorship, where torture and silencing were common methods and exile were common methods of reducing political speech and free speech, I think every political party has been soul searching for the last couple of years. So the main accusation levied against the transitional government that I was part of was that political parties are not mature enough. And the political leaders have let down the transitional government. I would say that, my reaction to that is that, first and foremost, there is a certain level of technocratic competence that is needed to rebuild a state from scratch, given the amount of corruption that we all discovered when we started working as sort of custodians to each Ministry of Health, And in the Ministry of Health, we have pretty much every political party under the sun somehow has a connection or affiliation, partly because it's for some reason or another, doctors and medicine are very highly politicized in Sudan and have always been at the forefront of political change. On the other hand, there's simply a lot of, external money that goes into the Ministry of, the Ministry of Health in some regards is an independent organization and institution. And it's been the history of that ministry has been very much one that was at the forefront of privatization under the former regime and sort of state capture of resources. And it's meant that we have this kind of partial health system where you have some of the best health workers I've come across, real strong capacities for things like tropical medicine, really diverse skill set. However, in terms of the systems, policy, planning, management, and supply chain, you need a functioning state, or at least a functioning federal agreement in order to make that work.
Wow, okay, there's a lot of things to unpack there. It's very interesting you bring up the factionality of Sudan immediately in terms of the federal system and how the military and the civilian blocks aren't actually blocks as such. They're much more diverse and stratified than that. So let's start from this point. So you spoke a bit about the transitional agreement and the transitional government that was before October working. What was it from your experience? What was it like working in such an environment with all of these tensions on a day-to-day basis? Could you see the writing on the wall, as it were, that this would eventually collapse? I mean, I know, for example, that you mentioned Hemedti. He's such a controversial figure in Sudan and is well known within Sudan for being a controversial figure. How is it working under the same umbrella organization as someone like him for yourself, for example?
Yeah, excellent question, Ben. I would say that whilst working within the transitional government, there was a real sense for me of different spheres of operations and spheres of influence. And it was almost as though there were curtains and different stages and, parts of the transition that you were privy to and parts that you weren't privy to. Even senior ministers, I think, would be able to say that. Even Hamdok himself, I think, would say that there was always a number of games happening behind the scenes. So I think there were three major kind of factors that I had to take into account on a daily basis. One was that, the military was in charge of the council, of the Supreme Council, which, as you know, in 2019, that council was called the Transitional Military Council. And what had happened in 2019 actually meant that the military's role in the transition was reduced, but an agreement was made. Something that wasn't clear in the constitution was the exact role and roadmap for the Supreme Council. It became, half civilian, half military. And the idea was that the presidency was supposed to be handed over to the civilian portion, actually, sort of sometime last year, and then it got extended as a result of the Juba peace agreement. So, the coup coincided quite neatly with the original date in the Constitution of 2019 of the handover from military control of the Supreme Council to the civilian bloc. And actually the main kind of civilian force that the Forces of Freedom and Change have put in the Supreme Council had resigned, I think, in May or June, if I'm not mistaken. And that resignation also kind of created this even bigger quagmire and distance between the Supreme Council and the transitional government. It was very much as though two different meetings were always happening. Like there was one of the first thing that happened when our administration started was the famous Paris Club meeting in Paris, which was a big debt relief meeting that Macron put a lot of energy and effort into, as well as the French embassy in Sudan and a number of people. And, when we got the list kind of privately within government, we saw that the vast majority of seats were going to the military to go to Paris, which, given the fact that we were existing in these two very different spaces. I mean, my main interaction with the military and the security apparatus was the bodyguard of the minister, Yasir, who's actually, you know, in the beginning, I didn't trust Yasir. I just thought, okay, is this a spy from the military? Like, it was just a real feeling of everything that you did was being watched. Everything that you did was leaked into social media and was used by unknown people to stoke the fire. So there was a kind of second dimension other than this sort of, you know, this invisible but omnipresent military force, which, you know, was no longer present on the streets as it had been in my previous visits. You know, when you walk down the streets, you really didn't feel the sense of the Ministry of Interior, the Ministry of Defense, like everywhere. It didn't feel like the city belonged to the military anymore, which made Khartoum for me feel like much more of a civilian space. For others, particularly for, say, some of my family members from neighboring villages, they had a sense that, well, this meant that crime was increasing, that petty crime and petty theft was increasing. And my argument was often that, well, there were much bigger crimes against humanity happening to us when the former regime was there. Right, we may have felt security and protection because we saw police officers and military on the streets. However, it was those same police officers and military that were the ones taking our rights away and doing legalized, you know, inhumane acts. For example, you didn't feel safe to drive with somebody in a car past 10 p.m. if you're a man and a woman, unless you have marriage papers or you can prove that you're related. So there was a real sense of social and psychological control that also was kind of very much ever present in the work that we try to do as advisors with the civil servants. Now, as advisors, we started to form a kind of group within the transitional government in a very disparate sort of way. And advisors were basically a very new thing for Sudan. I mean, like in the UK, or when I've had clients in the past in my former life as a consultant, we used to have clients from various sort of ministries of defense, diplomatic missions, etc. And it was very clear that advisors were a very normal part of any, of any functioning system. In the former regime, which is known as the Kazan, that wasn't common practice, at least in the Ministry of Health. The common practice was that the general directors and the undersecretary decides everything. So there was a real suspicion of advisors for all the civil servants, because these, and in particular the Ministry of Health, are ecosystems of people that have known each other for a really long time, despite some of the political factions. And they were also, there were also a number of political parties who relied on having their spies and their people within the ministry, which meant that it wasn't just the former regime that we were kind of on edge about. It was pretty much every political party that was not satisfied with the way that things were going and were trying to assert their capacity, their ability to make a better plan. So in the minister's office, I don't know how often there would be doctors' unions of specific political parties just bringing their vision for, this is how we think you should run the health center, and this is how it's going to benefit our group of doctors financially. So there was just constantly competing factions within the civilian space and the other political parties. So it was a sense that you never really felt safe with anyone. I would say by about August and September, at least in the Ministry of Health, and I got this sense from the Cabinet Affairs Office, that we really started to see a sense that, okay, we have a plan. We're moving in a strategic direction. We were working very hard on sort of strategic plans. But then there's also sort of the third really key block, and the most important block is the wider population in the country, which at the moment, I think, anybody that comes to speak to you about what the population thinks, what the Sudanese people want, I think is just lying. There is no singular person or singular authority, even the resistance committees, on what is the Sudanese popular narrative today. I think the narrative is, as it should be, it's multiple discourses that are happening at the same time. And that's very much needed in order to create a political culture through which a foundation of some kind of functioning state could actually be imagined. However, a population that has spent 30 years not really voting, not engaging in democracy, not having a say, resulted in a kind of what I experienced as a sort of schizophrenia, of like, okay, now there's freedom in the country. Now we have a say. Let's say absolutely everything. And I think what we missed was really and what we were starting to grow was something to bridge that gap between those in decision-making positions and the broader population, and that's the role that civil society, that advisors, that NGOs ought to have been playing. But that space was very much being occupied by political parties, which meant that broadly an agreement was reached by the diaspora and the Sudanese population in Sudan that this isn't working. And unfortunately, the military took advantage of that and used exactly the same rhetoric that is used by every kind of authoritarian, even whether it's, ISIS or Al-Qaeda. There's often, as my former boss used to say, there's often a correct diagnosis of what's happening in the rhetoric and the speeches of violent authoritarian groups. It's just that what they prescribe as the solution isn't often made clear, isn't transparent, and ultimately they sort of lie about the way that they want to do it. Burhan promised he would bring about peace and a democratic transition. So he spent the best part of that month in October and November trying to get a new prime minister. And guess what? Everybody said no. Everybody refused to work with him. So he had to go back to Hamdok. The problem was Hamdok, I think, wasn't really aware of how much leverage he had on his side, because he was under house arrest that entire month. And he had the entire international, quote unquote, community. I have another, mentor that always says, don't talk about international community, because it's not really a community. To be a community, there has to be something quite shared. Now, what I would describe rather the international scene is really, a group of very different interests in Sudan. The US on the one hand that really wanted, that had invested politically and had to save face for this investment. So they really wanted to get a peaceful transition, but they wanted it fast because, frankly, for them, Ethiopia was happening. They only have one envoy, it seems, for the entire region. So unfortunately, given all the resources that America has, they only seem to be able to dedicate one foreign envoy to the entire region, which has actually meant that American foreign policy in East Africa has been wanting, to say the least. The other dimension, of course, is with Hamdok, is that after 30 days, I think almost of house arrest, the psychological toll that must have taken on any person is unimaginable. So I do think that there were a number of people in Sudan who were sympathetic and said, look, the guy was really trying to do something. So there was a period after that, a few weeks, where people were angry, many people resigned, many people said we're not in favor of the political agreement because we think that Hamdok's political agreement is just essentially making it so that it whitewashes all of the crimes that the military have done and the fact that this was a coup. However, there was a growing group that felt, well, actually, perhaps this is the only way forward. And I think that led to a cautious optimism around the time I was finally leaving Sudan at the end of November. I thought, all right, I can leave now for a little bit. Because, when the coup happened, I didn't want to be one of those diasporas that had never, lived in Sudan. And then the minute that things got terrible, just left the country. But now, since Hamdok resigned at the end of December, that space of cautious optimism appears to have disintegrated.
Well, there are two things I would touch upon here, and we'll come back to Hamdok and the international community, the prescription of the international community. If we want to use the language that we've been using, how is the government functioning now without the civilian component in the same way that it was pre-October? I think especially even in the health sector, I'm thinking about the response to COVID and vaccination. There are multiple other health instances. You say, for example, malaria, and even education for the populace about various things. But how are these initiatives, how have they been impacted by all of these events?
All of these health initiatives that we'd set up, which included, access to COVID-19 vaccinations, increasing PCR, and even I think last year there were talks of introducing rapid testing. We were really lucky, I think, in large chunks of the transition, that the health network of Sudanese intellectuals in the medical health and scientific fields is really quite incredible. So we had a Dr. Shahinaz, who actually I think was affiliated with Boston-based universities and had worked with MIT. She was really the brains behind a lot of the testing strategies in 2020 and 2021. And people like her, who carried a lot of institutional memory, were essentially removed almost instantly, as were, directors of primary healthcare, of the emergency units, where, a lot of what we do in the health system in Sudan is to compensate for an absence of data by using highly experienced, intuitive ecosystem of health workers. And that can often lead to unexpected successes in things like vaccination campaigns, or in things like bed net distribution for malaria. However, there was already a toll, and I'm working on a piece now with UNICEF about the impact of COVID-19 on routine immunization and other morbidities in the country. In 2020, UNICEF data shows that there was a kind of polio outbreak happening in the summer, but the already limited resources that the Ministry of Health had meant that a lot of testing capacity had to be used for PCR testing and COVID-19. That means that there was a slow polio outbreak that essentially we didn't know about until quite late in the game, meaning 3 months on. I wasn't in office at the time, so I can't tell you if the outbreak was announced in the end or not, because announcing epidemics and outbreaks is a very politicized endeavor. But now there's certainly a concern that, the last 3 months, what kind of outbreaks are there? There was also growing concerns of measles outbreaks. It's rainy season at the moment. It's the second rainy season of the year. So that means that malaria will be at a peak point again. Thirdly, there is a coronavirus epidemic in Sudan. And it certainly looks and behaves like what's being referred to as Omicron, the fourth wave of COVID-19. The data and research shows so far that Omicron is less lethal, even if it is more infectious than previous strains, which indicates that the virus may be kind of moving, evolving, and morphing as we're more equipped with vaccinations, we're more equipped with sort of higher immunity to it, etc. However, when we talk about getting access to vaccines through the COVAX mechanism, we're talking about like a very small percentage of the country and a very targeted sort of campaign. We're not talking about mass vaccination distribution. We're talking like, less than 5% of the population. So the vaccines as a strategy for the health system in Sudan were not about herd immunity as they were in Europe. If I'm really being quite blunt, what we were offered in the COVAX mechanism were essentially the leftovers of the AstraZeneca with a short shelf life from countries, which obviously it's important to be thankful that some of our colleagues in the French embassies and in Dutch and American embassies worked extremely hard to make sure that there was a supply chain of constant vaccine, a very healthy pipeline of vaccines. But in the end, it wasn't enough. And it was taking away much needed human, financial, and supply resources away from taking care of much more fatal burdens of disease. So all of these kind of big epidemics and outbreaks, that's really, the sort of sexy stuff, the stuff that people really like to talk about. But places like Sudan will always have a high burden of NCDs, non-communicable diseases. And we already had a crisis of a huge drug shortage. And the Minister of Health, Dr. Omar al-Najib, the minister that I was the advisor for, had actually managed, after 4 months of intensive negotiations with public and private stakeholders in the drugs and manufacturing sector to make a pathway for reducing the debts of the public medical fund. That was announced in the end of September. And, it was being rolled out from November. And we were expecting that by January or February, we would be on track to once again having publicly available a list of essential medicines in the country. Today, even if you can find drugs, you don't know the expiry necessarily. You don't know. There's no possibility for regulation of drugs and medicine. So while it's important to be worried about the bigger things like epidemics that international NGOs and institutions like UNICEF and WHO will kind of mobilize around, there are also much more daily primary healthcare needs that include, things that can go wrong when you do finally make it to a health facility, which includes medical malpractice, nosocomial infections, which are extremely high. Nosocomial infection means when you go to a health facility and you actually end up picking up another disease, which is why it's really important when you do any COVID-19 treatment or testing that you have separate lines in separate places. We can't really afford to have those measures in the country right now. Who's distributing masks? How are the elderly going to be able to get around? On top of the fact that most of the roads are blockaded on an almost daily basis, either by revolutionaries to ensure that the military can't infiltrate revolutionary strongholds, one of which I'm based in, called Burri. On the other hand, which makes it very difficult for ambulances to get around the country. But on the other hand, we have what can always be expected in a situation like this, which is that a kind of unregulated black market has the opportunity to emerge and potentially have very damaging effects on people's healthcare. And for me, the people that I often am the most concerned about, we saw this with COVID-19 globally, is when it comes to women's sexual and reproductive health and their rights. So there are going to be women now in Sudan who are pregnant. Let's say their third trimester, they should be giving birth. Where are they going to give birth? Who, how are they going to be safe when we have one of the highest rates of maternal mortality, not only in Africa, but in the world? Secondly, what if the woman is second trimester and she needs regular care, she needs checkups, she needs antibiotics, etc. That's not going to be available. But even more worrying than that, what if she's first trimester and she is not interested in keeping the baby? Now, it is still taboo to talk about safe abortion care in many countries in the Middle East and North Africa. I would say that that's still the case in Sudan, even though it's not against Sharia. There are certain specific measures in which you can get an abortion. But the issue is that, by and large, more women die from getting access to an unsafe abortion than they did from Ebola in the first Ebola outbreak. So unsafe abortions are one of the kind of silent, very prominent epidemics in many countries. And those are the kinds of practices that will increase and lead to undocumented deaths of a number of women.
So from what I'm hearing, there seems to be a bit of a tension between, say, the functioning of the state, especially in these essential services, and the political action that is currently being taken, both by the military authorities, but also by the protest movement. So what I would ask you then is, from what you've seen and from what your interactions, what is it that the protest movement want when it comes to any sort of political settlement? Because as we've seen, the international community, the European Union, for example, we see people in the European Parliament mentioning this often. They talk about re-implementing Hamdok, even though he already resigned the start of this month. They talk about releasing other ministers, and although a lot of that has already happened, but what do the protesters want to be able to move this situation forward?
So I will caveat my answer by saying that I'm not qualified to answer that question in full. What I think I am qualified to do is maybe lay out some of the nuances that I've observed around the sort of four stakeholders that you've just mentioned, you know, the military, the resistance movements. Let's put the kind of let's put another block in the civilians as, you know, the professional classes, the civil servants, etc., and the international forces, and then the position on Hamdok. Now, I would say that at least the resistance committees in Khartoum and the youth that I'm in contact with are very much, this is the real revolution, meaning that we are no longer at a stage of dreaming, designing what that state will look like. We're in a full-on stage of taking down the existing status quo from which we can build, which I think is a very valid political change theory. It's one that, you know, certainly has enough anger to fuel it. I'm just concerned that it's taking so many of the lives of young people. Last week on Monday, I think there were at least 9 killed in one day at the protest. So that was a week ago today. And we're recording on the 26th of Jan. So that was the 18th, 19th of January. And that was the largest number in one day. However, there's a young, researcher and policy officer, also by the name of Asil, who I worked with a lot in Sudan, and she alerted me to the fact that, you know, the number of the kind of frequency of deaths and the rate of death of the protests since October 25th is way higher than any period in 2019, if you don't include the Black Friday in 2019. So kind of violence with impunity and violence with, just no desire, like from Burhan's side, from the police side, to even really engage in a sensible conversation about these indiscriminate killings of protesters. And there's a cycle of quite a vicious cycle of the protests movement and the military getting more violent, the protest movement getting more resistance, and the gap between them. I would observe that today that the gap is so huge that there really is no reconciliation point there. And perhaps for some that could be the only way out. Then you have, I would say, another group that maybe more falls along the lines of the professional classes, who have a bit more stake of staying in the civil service, of there being a state. I mean, for most people in Sudan, it is an interesting question to pose, you know, what is the nation state to you? Does it really exist? Do we have institutions that we can rely on? So for many on the streets, I would say that they see these institutions as things that are not things that have ever really represented them, and they want them all gone so we can start from scratch properly. In parallel, there are resistance committees that you might have heard of. These are committees that were born in 2019, broadly as an extension of the Forces of Freedom and Change. And they mostly made up of youth under the age of 25. People I've spoken to said, you know, you could be in a resistance committee in one neighborhood and not know that your brother is in another neighborhood. It was very secretive in the early 4 months of 2019. And what they would do is essentially organized tasks of, ruining the military's plans. You know, it would mean things like being on one street at a specific time and like slashing the tires of every military car, you know, really just in a very organized sort of way, is just sort of reducing the capacity of the military. And that's essentially, those are confrontational tactics. Now, when movements like the ANC in South Africa were mobilizing and being clever and smart on the streets, you know, you had figures like Nelson Mandela rallying and using that to bring negotiations to the table, and that has now failed. So there is no real negotiating space today for Hamdok, and I don't really see how he could be reinstated. I think that it's a bit naive of the European community and of the kind of international forces to hope and expect that one man will save them all. You know, when I think what that's really saying is, this is the person we're familiar with because he's an ex-UN guy. We know him, we understand him, we feel safe with him. And gosh, isn't it, you know, frightening to talk to these military people, and like, God forbid that any of us actually learn Arabic and try to figure out if there are other political figures and leaders in the country, because it's all too complicated. So I'm disappointed in the weakness of, firstly, some of the news and journalism reporting that was happening in October was very, it showed a real absence of insight and understanding on what's happening in Sudan, and the real kind of absence of, but for lack of a better phrase, just nobody's really seems willing to put the work in and understand what's going on in the country. There are a few, certainly, there's a few think tank specialists like yourself, like Cameron in the US, like Khulud Khair, who I would definitely recommend listening to in Khartoum. However, those are few and far between. And even if Troika has been dangling a number of promises, I don't see yet enough from the British or the Scandinavians or the Americans when it comes to eyes and ears on the ground. These eyes and ears are obviously very difficult for these countries to get into because they weren't really allowed in the country for a long time. Sudan's been closed off. So we are also victims of the consequences of the former regime, which have reduced the tools and resources at our disposal to fight this fight. Now, what we have at our advantage in terms of those that would like to see a civilian, transitional, democratic, justice-driven process starting up again in Sudan at some point in the not too distant future, I think what we're able to do is see that now the diaspora have been able to engage again. And diaspora is a very broad term for Sudan. There's like several waves of diaspora engagement. So it doesn't just have to be the block that I come from, which is, the University of Khartoum graduates' children that were political exiles in the 80s. There's a number of, bright, talented Sudanese who have gone on to the Emirates, to the States, to other parts of Europe and Southeast Asia that have formed quite a powerful network within institutions like the UN, within the private sector, within the oil industries, and even within policy and journalism. So I think that there's a lot of fruit there to now do what I think we all have an obligation to do, which is get people more informed about Sudan so that it's not this black hole that people don't understand anymore. So I think we need to increase the literacy on Sudan first. From increasing literacy, you can actually start to engage in meaningful discourse and dialogue. Now, I think it is as disappointing as it can be for us, where we're feeling a sort of sense of urgency. It is a positive sign that the Biden administration isn't jumping to conclusions at the moment. I think we shouldn't, have such a one-sided negative view of American foreign policy today. This 10 years ago, it would have been boots on the ground, and there's no appetite for that at the moment. And we certainly don't need that, given that it's a peaceful resistance movement. Now, are there possibilities of violence erupting? If there are possibilities, I don't see them happening in Khartoum. I see them being staged in the peripheries, more in East and Western Sudan, where also Sudan is host to a number of refugees and migrants displaced from other conflicts, including the neighboring civil war in Ethiopia and the climate crisis that's deeply affecting the bordering areas with Chad, as well as localized conflicts that are re-emerging, which are naturally, bound in this stage to increase as there's going to be a capture for very limited resources. So I think the second important thing is really around, where the traditional tools of multilateralism, we know that they're not working the way that they used to. The 2016 migration crisis, I think, was a real shift in geopolitics globally, which has meant that bodies like the platforms like the UN Security Council, the European Union, etc., no longer have the necessary political and financial capital to be the guardians of international human rights or humanitarian law or any other international regulations. Look how long it took them to get Umar al-Bashir to the ICC. He was indicted, and it wasn't a single European or American that managed to get Umar al-Bashir to the ICC. It was the Sudanese people that did it. So I think what we need to see now is a new era of geopolitical engagement, which is not just about the high-level politics that is often full of quite a lot of jargon. That's in spaces like Whitehall or in DC and even in Khartoum, what we see a possibility for, which is why social media is always shut down, is that the resource mobilization is possible through social media. Now, people often talk about knowledge and information and how biased it is, how you can't do a lot of digital verification, even though there are groups like, Bellingcat who, do kind of geo mapping of open source flight and shipping memos, so they can actually challenge narratives of the Russian and Syrian government, who will always say, no, we didn't bomb this area. Of course, the Saudis are going to say, whoops, it was a mistake, we bombed this hospital in Yemen. Or the military in Burhan's military are obviously going to say, no, we didn't shoot those protesters, we would never do that. Because all of these groups have internalized international humanitarian law and international human rights regulations, because they've all received trainings on it in the 90s and the 2000s. That's what the UN spent their money on, was train all of these armed groups in the hopes that they will fight less. No, but they're still fighting, but now they have the discourse and the language to ensure that they can hide from any punishment for doing what they want to do. So this resurgence of militarism that's happening in Africa is something that we need to recognize, means that the nation states on the continent are being captured by forces that are not friends of peace, justice, or human dignity, which means that social movements need to be engaged in with all of their complexity. And that means having multilingual platforms for discussing political views and ideas, having spaces for training and learning. And most importantly, what I'd like to see happen this year, especially in my network, is scholarships being established for young Sudanese youth, so that there isn't just the option of, die at the protest. It could also be get a scholarship to prominent universities all over the world, get political and negotiation training, so that what I'd love to see, next year or so is young Sudanese people going themselves to Congress and saying to Congress, this is what we want and expect. Young Sudanese people going and speaking for themselves at the UNSC. And this is a generation of people that are more literate in Bitcoin than most of the people I've met in Europe, that understand, there are all these possibilities underneath it. So the only way forward I see is that there must be a parallel, less formal track that is outside the state, where resource mobilization is prioritized, but also long-term sustainable resources are made available to young people in Sudan from all over the country. And that, unfortunately, has to happen through these loose networks where you cannot really say who people speak for, which side they're on. It forces us to kind of engage with the messiness.
Well, okay, thank you for that, Doctor. I think that's a good place to end the discussion for now. I'm glad you brought up a bit about what the international community can do, because I know that there needs to be a lot more nuance with engagement. There's a lot of repetitive strategies that have worked maybe once or twice in the past that are, they are then superimposed into new contexts and new crises and expected to work. And no, of course, they're not going to work. You need to have a bit more contextual understanding. You need to be able to know who you're talking to, right? You need to be able to engage better. You need to use the language that people use in those countries. Otherwise, change is up to chance. So to actually be able to support something, there needs to be better engagement there, better nuance. So thank you for that. Okay, so thank you so much, Doctor, for joining me today for this episode of the podcast. And for all of our listeners out there, please join us again for another episode of the MENA Talks very soon.
Thank you for listening to another episode of the MENA Talks. Share your thoughts with us on social media with the hashtag MENA Talks, and follow us to receive our latest news and updates. The MENA Talks is a podcast series on the Middle East and North Africa, an initiative of the Brussels International Centre.